Hello, everyone in Las Vegas. Thank you, Marife, inviting us here to talk about Asian American and minority mental health.
The first question is, what does minority mental health mean to you? Maybe we'll start with Dr. Park.
Sure. When we talk about minority, there's a multiple different definitions of minority. It could be gender minority, or it could be economic minority, where we certain population may have more economic resources than others. We could also talk about political minority, where a certain segment of population is more political power than others, therefore more influence on policy issues. We could also talk about gender, sexual orientation, and gender identity minorities who we are currently hot area as of mental health issues. But today we also want to talk about race and ethnicity. What that means is that certain racial group or ethnic group may experience less attentions from mental health resources or professionals. Or we could also talk about linguistic minorities who may have speak non-common languages. Therefore, they have less access to linguistically suitable healthcare, mental health care. So when we talk about minority mental health care, we have to think about what kind of minority are we discussing here? Although granted that we are talking about racial minorities, specifically Asian Americans who may have a different concept of what is mental health. Therefore, your healthcare provider might not agree with our patient's concept of what is mental health.
What are the current challenges in minority mental health that you see, Dr. Park?
I will limit our conversation to more race and then cultural minorities. So, continuing our conversation before, being minority will expose us in a very different type of stresses and in different culturally specific ways of handling those stressors. The question then becomes, can Western or typical healthcare system can address those patients, minority patient who has a unique cultural concept of mental health issues or mental illnesses, or they do have a different expectation from their healthcare provider, and maybe their healthcare provider might not be able to address that, not because they don't want to, but because they're not aware or not well prepared to it.
They just don't know how to deal with it.
Exactly.
Right?
So, so those are one of the biggest issues that we have right now. The second component is that Pack briefly mentioned that certain type of therapeutics are reimbursed by the insurance company when others. But oftentimes, minority patient may have a preference that does not concordant with what insurance company might cover. So what that means is it may cost more for us, right, to access those type of treatment. And then that's also not good.
So, Dr. Park, last words of wisdom.
Oh, thank you. Self-care is very important, but sometimes when we are really down and then having really difficulties, friends and family can help us to lift us so that we can actually get better and then be able to take care of ourselves. So look around and see any of your family, friends, or loved ones are having difficult times. Approach them and then see whether they need help or how can you offer. Is there any help that you can provide? I think that would be very important. Sometimes loneliness and feeling alone and nobody can take care of them, nobody can love us, and then that's one of the biggest reason why people feel depressed and anxious. So we can offer our help to our loved ones to feel better. So I just want to emphasize that for our last point.